I want to acknowledge that 1 year ago, the city of Houston and the surrounding communities first began to confront the realities of the COVID-19 pandemic. It started with the cancellation of Cero Week in the first week in March, and several days later, confirmation of positive cases. I recognize that it's been a challenging year, and I think that's an understatement for each of us, from wearing masks, social distancing, to testing and getting vaccinated. And the heartbreaking deaths of Houstonians, including many City of Houston employees. Who would have thought that a year ago, that a year later we would have more than 500,000 plus deaths in the United States. I thank everyone for their patience and cooperation. And while we can see light at the end of the pandemic tunnel, the train is still on the track, and we need to keep doing what we have been doing to crush the virus. On a positive note, today's positivity rate is 11.8%. You know, not too long ago, it was, it was over 20. Now we're back down to 11.8%, but the goal is to get us down to 5% or lower. But also today we're announcing 914 newly reported cases, and unfortunately we are adding 7 new people to that number, people who have died as a result of COVID-19. I want to remind everyone that testing is still available, and it is free at any of the city-affiliated testing sites, which you can find on the HoustonEmergency.org website. So please let me encourage people to get tested. The Food and Drug Administration has just approved Johnson & Johnson's COVID-19 vaccine for use in the United States. This makes the 3rd vaccine available to fight the virus. Tomorrow, the City of Houston Health Department will receive its first delivery of the Johnson & Johnson vaccine, an estimated 6,000 doses, and another 9,000 of the Moderna vaccine. That's a total of 15,000 for this week. The Johnson & Johnson vaccine is a single-dose, highly effective vaccine, and the city will add it to its supply. It certainly will be the best option for our transit populations, and what I mean by that, because you only need that 1 dose, for people, for example, our homeless population, which is very difficult to get back for that 2nd shot. The J&J vaccine will certainly work well there. We've got a lot to cover today, so let me pause quickly and bring up first Dr. David Pearce. Now let me bring up Director Williams, and then followed by Dr. Pearce, and then Chief Pinion.
Thank you, Mayor. Today, our department is actually opening up and expanding our wait list. Our wait list is used to schedule the department's allocation of appointments at the FEMA sites, as well as our other vaccination sites. We will continue to use the state's criteria for 1A and 1B. The department's wait list was previously open to those 65 years and older, and those 60 years and older with chronic conditions. The waitlist expansion ensures more people in our community who are eligible for the vaccine have access. I'm encouraging everybody to use our online vaccine portal at HoustonEmergency.org to set up an appointment for the Johnson & Johnson vaccine or to sign up to the Moderna waitlist. Registration is also available by phone to people aged 60 and older through the Area Agency on Aging at 832-393-4301. People with disabilities can call the Aging and Disability Resource Center at 832-393-5500. Anyone else needing registration assistance can contact the COVID-19 call center at 832-393-4220. Many people will ask, why do we still maintain a call center? And the reason is really simple, and that is because everybody is not technology competent and actually needs assistance. And so therefore, we continue to have people call into our Area Agency on Aging and other call centers for that assistance. We want to ensure that not only people and vulnerable communities have access, but anyone who is technology have technology challenges. On a call with a number of my colleagues across the country this weekend, that was one of the things that we talked a lot about, and that is, for an efficiency standpoint, we're certainly going to go online, use technology to the extent that it's feasible and possible, but we have to ensure that we provide access for everyone.
Thank you, Mayor. The one thing I want to talk about today is that our wastewater over the weekend has been paralleling what we've been seeing with positivity rate. Positivity rate has been dropping, as the Mayor pointed out, and that's good. We've also been seeing less and less virus in the wastewater, which is good news. The problem that we're seeing, though, however, is that we are seeing an increasing amount of variant within the wastewater virus. We talked about this a little bit before. And it's predominantly the UK variant that we're seeing. Now, remember, this is wastewater, so when you test an individual and you detect a variant, you can sequence it, you know where that it came from that individual. With the wastewater, it is, of course, all mixed from many, many, many people. So, so it's a little bit hard to know exactly what that means in terms of numbers of folks that may have the UK variant, but we are seeing that the UK variant is increasing. So what does that mean for us as a community? What that means for us as a community is that we're in a little bit of a race, because we've seen what the UK variant has done in other communities. It is more easily spread. There is some discussion that it may make people sicker. It doesn't seem to be devastatingly, but nevertheless, some people may require hospitalization at a greater rate with UK variant, but it spreads more easily. So we've got three things going on at once that we need to pay attention to. One is vaccines in the community, and people need to go ahead and get vaccinated as soon as they can. And obviously, there's lots and lots of effort to get vaccine moved into people's arms as quickly as possible. Right now, our rate limiting step is the supply of vaccine, and so we're working with that. In the meantime, we can continue to do those things like wear masks, social distance. They are highly, highly effective. They work very well. When we look at what happened from really October through January and February, as we had that wave, I think we all can see how that was probably, my opinion, is that was because we dropped our guard as the holidays, beginning with Halloween, and we started becoming lax with our behavior. And then after the holidays, after New Year's, people started focusing on what they were supposed to be doing all along, and the numbers have now come down. The mask wearing, the social distancing remains our single most effective intervention, because there just isn't enough vaccine yet. So we've got vaccines beginning to come to the community. We can still put our foot on the brake, but we need to do that, and we need to remain diligent and not take our foot off the brake, because the UK variant is clearly here in the community now, and it is spreading. So to some degree, we got a little bit of a race. Can we get our, can we keep these numbers down versus the UK variant exerting its impact? And the other thing along those lines I want to remind folks is that when the storm came, the winter storm came, the number of people getting tested obviously dropped down. We, in fact, had to close our testing sites because it was too cold. We need to get folks need to start getting tested again. Remember, certainly if you have symptoms and you get tested, you will learn whether or not you've been infected with the COVID. But 40% of people who are infected have no symptoms. And so it's really important for you to go and get tested, because the other part to keep in mind is that if you are infected, the person you are most likely to spread the virus to is a member of your own family. So protect your family members. The testing sites are up and operating again, and there's plenty of capacity there because, unfortunately, our numbers are down. So take advantage of it. Go get tested and protect your family.
Thank you, Mayor. I want to really quick give some positive news for the numbers for the Houston Fire Department. Today we are at 45 members of the Houston Fire Department in quarantine. That's down from over 200 just a few weeks ago. We did change our protocols for quarantine, and which has helped, and it's helped with having people available for staffing. We had over 727 firefighters that have tested positive for coronavirus to date. 27 currently, and they're all recovering at home. If I may switch gears just a little bit, Mayor, just to discuss, we got several calls of a smell of natural gas in the Clear Lake area. I want to assure the public that it's not a gas leak. We've gone out there and searched. We haven't found any source. We believe it's just the odorant that's added to the natural gas, the mercaptant. And this is a reminder: if you smell natural gas inside your homes, go outside. Do not use the phone. Do not flip any switches on or off. Go outside, use your phone, and call 911, and we'll go out there and evaluate the incident. Thanks.
Thank you very much. And if you'll hold on to your questions, I just want to finish up a few other things, but I do want to highlight the 9,000 doses, the 6,000, the 9,000, 15,000, the 9,000 Moderna, the 6,000 J&J. That's in addition to what's happening at the mass distribution FEMA sites. I want to say that is in addition to, not a part of. As Houstonians began to access and address the costly damage caused by the recent extreme winter weather, the Houston-Harris County Winter Storm Relief Fund has raised now $7.1 million. And I want to thank the generous sponsors. Today, the fund is announcing that it will invest $1.65 million in emergency grants to support vulnerable families and individuals in critical need of home repairs due to busted pipes, water damage, and prolonged power loss during the recent freezing temperatures. Given the urgency for assistance, the Fund's Grants Committee quickly approved this initial round of grants less than a week after the fund was launched to help the most vulnerable in our community who are traditionally underserved and in need of emergency repairs. The Foundation and United Way are now accepting donations online at www.winterstormrelieffund.org. That's www.winterstormrelieffund.org. Those impacted by the storm and needing help can text Houston Freeze, or for Spanish, text Houston Ayuda to 898-211. Individuals will be texted back with eligibility and application guidelines. Today, I'm also pleased to announce that NBA All-Star MVP, philanthropist and entrepreneur Russell Westbrook, is donating to the Houston-Harris County Winter Storm Relief Fund, even though Russell is no longer playing for the Houston Rockets. His love for this city continues. In fact, I talked to him at noon today, and he indicated this is still one of his favorite cities, and I want to thank Russell Westbrook for stepping up and for making his contribution. His $100,000 gift from the Russell Westbrook Why Not Foundation will help people repair their homes. So, Russell, thank you so very, very much. I look forward to continuing to play with you in the NBA. We now find ourselves talking about resilience every day, not just resilience to flooding, COVID-19, and the cascading impacts of that crisis, or intractable disparities and inequities, or to extreme weather, but resilience to the priorities and choices we have for generations. We prioritize thinking differently about this cycle after Hurricane Harvey by working with the stakeholders to develop actions that we needed to take to make Houstonians, our neighborhoods, our watersheds, our city, and our region more resilient. That roadmap, Resilient Houston, was released in February 2020, and today we release our Resilient Houston 1-year report. I'm proud to say in this unprecedented year, over 90% of the 62 actions in our plan are moving forward. We have Department Resilient officers in every department, working with my Chief Resilient Officer, Marissa Aho. And in partnership with Rice University's Kinder Institute for Urban Research, we are tracking the 18 Resilient Houston targets and additional targets from Houston's Climate Action Plan on a website that also launched today. Resilient Houston is focused on health, climate, equity, the built environment, and the economy. And it calls for additional preparedness training, weatherization, support for small businesses, integration of mental and behavioral health with preparedness, response and recovery programs, addressing food insecurity, modernizing building codes, embedding resilience into all of our recovery efforts, and so much more. Every action we take and investments we make should continue to improve our collective ability to withstand the unexpected shocks and disruptions when they arrive, like 2 weeks ago, from hurricanes to global pandemics to extreme heat or extreme cold. The time is now to stop doing things the way we have always done them because the threats are too unpredictable. The Resilient Houston 1-year report shows great progress, especially for 2020, but we are just getting started. We need to invest in resilient infrastructure. We need to prepare our neighborhoods to withstand climate extremes, and we need to support all of our neighbors so that they can thrive. I want to thank Shell for originally funding this work and continuing to support it. And I want to thank other partners who have supported the implementation of these goals and actions. And I am certainly thankful to all of those who work very closely with Marissa on building this Resilient Houston plan that aligns with our priorities and the work that we do and our collective efforts. Now let me bring up Marissa Aho.
Thank you, Mayor. So we know that our most vulnerable people, places, and systems are disproportionately affected when there is any disruption, whether it be any of the disruptions that we have had lately. And so that's why we have this holistic approach to resilience. And I want to thank Mayor Turner for being such a leader when it comes to resilience and for solving for more than one thing and aligning all of our efforts. I also want to take this opportunity to join the mayor in thanking our supporters and implementation partners. I want to thank Rice University's Kinder Institute for Urban Research for help with tracking our targets. I want to give a shout out to our department resilience officers. It's been a pleasure to work with them since April on moving all of this work forward, and you can see we've moved a lot of it forward. You know, the importance of building internal capacity within the departments to implement the strategy has been a critical component to seeing transformational change in our communities. And this year, we look forward to working with many more partners to address these challenges. The one-year report is available at houston-tx.gov/mayor/resilience-1-year-report.pdf. Thank you.
Thank you, Marissa. And look, all of these things are connected, from Harvey to Tropical Storm Imelda to the coronavirus, to even our social and civil unrest, to the winter storms. And it's about building resilience in all of our strategies, in our water, wastewater treatment facilities, in our building codes, in these communities that have been hard hit with busted water pipes. And now no water, in our transportation sector. And so all of these things connect, and I want to thank certainly Marissa for her leadership and all of the stakeholders that have been working together to address this, to address climate action and all of these extreme weather conditions that we are facing in the city. Now, at this point, let me yield, and I know we talked about several things in a short period of time, but any of these individuals are more than happy to take your questions.
Thanks, Mayor. I was hoping to start on vaccines on the waiting list. So you mentioned you're expanding the waiting list. Is that just now everyone in 1A and 1B can sign up, or is anyone able to sign up for the waiting list?
I knew that was going to be the first question. I told my staff I'm good.
Like the mayor said, he told his staff, yes, we're looking at 1A and 1B. To really put this in perspective, when we were doing our 2 large sites and our 4 health centers, we were able to use our call back list, our waiting list. And with the demand of NRG being 3,000 a day, that significant increase resulted in our needing to actually expand our reach. And so we're going to be very consistent with the state, and everybody that's eligible for 1A and 1B will be eligible.
Is that to say, Director, that you guys have worked through those, I think it was 70,000 names that you had, prior to NRG? Have those people, now been processed?
Actually, of the 70,000, we have actually touched over 50-something thousand. I think we've seen a little under 30,000, and we're still trying to schedule around maybe 27,000 or so. One thing that we're finding out is that people sign up for multiple wait lists, and that impacts, the response that we're getting. Also, I mentioned earlier the call center, and it's really important that we have that as an option. It is not our most efficient option. It's It's heavily staff intensive, but I'm comfortable with it because I know that there are a number of people that are not comfortable with using technology. And we need to make sure that our seniors, and this was our priority population, have an avenue to access our sites.
And then, Mayor, I think you were mentioning that new shipment of J&J shots will help increase capacity at the non-NRG city sites. Is that right, Mayor or Director?
Yes. The interesting thing is that the J&J is actually being sent to the FEMA sites initially. Hopefully by next week, other providers within the community will have access to J&J. But the FEMA sites are actually going to get the shipments first. And I just learned that earlier today on a state call. The overall expectation would be that we expand the number of providers that are available within the community so that our capacity will increase overall.
When you say FEMA sites, is that NRG or is that some of the other city?
NRG is the FEMA site. Okay. There are only two others in the state, and that would be in Dallas and Tarrant County.
And I'm just going to pivot to relief quickly, Mayor, if that's all right. You mentioned those first grants coming out for the Winter Storm Relief Fund. Is there more info at this point of how people can apply for that money, or where did those people who are receiving those grants, where were they found, or how are they reached? Yeah, those are individuals, for example, who have called in to the Greater Houston Community Foundation, the United Way. And then at the same time, this initial grant, it is a consortium. It's Habitat. Excuse me. There are several different groups that have come together that will be out there repairing people's homes. And the cost of that initiative is right at $1.6 million. And do you plan to open it up to applications, or is it just going to go through these organizations to try to find the people who need help? It's pretty much there's a grant committee within the United Way and the Greater Houston Community Foundation, but people are applying for the need. So if people, for example, find themselves with homes need repairs, the pipes have burst, and they're in need, they should contact. Again, I had it before me. I normally carry it with me in my pocket. They can text Houston Freeze to 898-211. So text Houston Freeze to 898-211. So if they're in need, homes or water's been turned off, pipes burst, don't have insurance or not enough coverage, don't have the financial means, if they'll text this number, then that would put them on their list. And then they're working with other nonprofits or other organizations. Together We Build happens to be one, Habitat for Humanities. There are different groups, other nonprofits that are actually going out there and repairing people's homes. And then United Way and the Greater Houston Foundation, Community Foundation, are providing grants to assist people in making those repairs. That's what's happening here. And then my last question is, I know rent relief opened to tenants applications last week. Do you know how many people have applied so far, and when do you expect that money to start flowing out? I can get that number for you. I don't have it right before me, but I can get it to you before the day is out. Thank you so much. Thank you.
Okay, I have all the pool questions. So the first one would be, when were teachers added to the health department wait list, and would you explain what that means?
Well, teachers weren't added to the health department's wait list. Basically, we're looking at 1A and 1B. 1A and 1B actually includes all occupations. So if we do an outreach to a school district, for instance, we will ask them for the number of individuals, say, within their organization that meets 1B criteria. Actually, I was looking at an email earlier today from one of the districts, and they specifically responded that X number of people meet the 1B criteria.
Is it in the drop-down menu when you go to select?
I think the better way of saying that, for example, of course, if you're 65 or older, you fall in the 1B category. If you're 18 and older and you have a chronic health condition, diabetes, obesity, things of that nature, whether you're a teacher, police officer, any sort of worker, you're eligible to receive the vaccine. So I think that's if I'm stating that correct. So if you're a teacher, for example, and you have diabetes, and you are 30 years of age, you are eligible for this vaccine or any of the vaccines. If you are 45, obese, or asthmatic, any of those conditions, you are eligible for the vaccine. But in terms of just teachers per se, regardless of your status, you're eligible. That's not in that category yet.
Okay. Is the city satisfied with the demographics and equity of the vaccine efforts right now?
I don't think you're ever going to be satisfied until really it's proportional to the impact. I think we've made some significant progress. I think Houston has done much better in addressing those having an equitable distribution than most other places. But I don't think you're ever satisfied until you reach that point of perfection. And we are not there yet, but we're certainly trending and moving in the right direction.
Many tenants at apartment complexes continue to report damages that have not been taken care of by property management. How is the city working with property owners of apartment complexes to make sure winter damages are taken care of in a timely manner?
And we had that conversation with my executive team this morning. There are a number of apartment complexes within the city of Houston where the pipes need to be repaired or fixed, and tenants are without water. I know the habitability team within Public Works is being dispatched and working in conjunction with the Department of Neighborhoods to really push these apartment owners and managers to take every step to repair the pipes and get the water flowing at their apartment complexes. One of the things that I asked my team is there any fault on the city's part? Is our system providing water to whomever, single-family home, apartment complex? And the answer is yes. So the problem is not on the city's end. The problem is with the apartment complexes. And I've also reached out to my legal department to do whatever we can to get these apartment owners and managers to fix their complexes. And we will certainly be advocating for these tenants who are in conditions that simply are just not habitable. So we're very much concerned, and we're going to do everything we can to really encourage and push these apartment owners and managers to fix their properties.
If someone finds himself in a situation without water after 2 weeks, what should they do?
Call 311, and we'll do whatever we can to assist. I know my team and Councilmember Tasha Jackson, for example, in District B, and others were at an apartment complex on yesterday, providing water and food and other essential items. And we'll be prepared to step up and do the same thing to try to do everything we can to assist these tenants, these families, these individuals. 2 weeks is a long time, and that's why let me just say to apartment owners, to apartment managers in the city of Houston, please immediately move forward to make the necessary repairs, get the water restored. The water is available, but if there are busted pipes at these apartment complexes, they need to be fixed post-haste because you're talking about not just one family, but a lot of families in these apartment complexes that are being adversely impacted, and it becomes a health crisis.
2 more questions from Fox on that topic, and that is there a way to hold landlords accountable for fixing these water issues?
We're certainly going to look at every conceivable thing we can, and I've asked Arturo Michelle with the city's legal department to take a look at that. Public Works, the habitability team within Public Works will be out there taking a look at it. So look, I find it, how can I put it? It's just not healthy, neither is it safe, and neither is humane. These families have gone through a lot, no fault of their own. As I heard one couple say the other night on television, these apartment owners and complexes, they want their rent on time. And they still want their rent, even when there's no water. And that's just crazy. So what I would say to all of these apartment owners and managers, the city of Houston will do everything we can to hold people accountable within the confines of the law. But just fix your place, fix your complexes.
And one more on this topic. Do you recommend people breaking their apartment lease and moving if they're without water still, or should they just keep waiting?
Now say the question one more time.
Do you recommend people breaking their apartment lease and moving if they're without water still, or should they keep waiting?
Well, let me let me not render a legal opinion here. Let me just say, as the mayor of the city of Houston, I expect the apartment owners and the apartment managers to do the right thing.
The state is going to send thousands of doses of the Johnson & Johnson vaccine to the Houston FEMA site tomorrow. When and how will those be administered, since the NRG site is already doing 6,000 doses a day of the Pfizer vaccine?
Well, I'm hoping that those that will be sent there will be reassigned, but let me leave it up to the director to see if he's got a different answer.
No, Mayor, I don't have a different answer. Actually, they will go to NRG because it is a FEMA site. But what we're looking at is actually choosing one of our other sites to distribute those doses. One thing that's uncertain, we know that those doses are coming this week, but we don't know what the frequency of that will be. Overall, our expectation would be that in the long run, we integrate J&J into a broader system of delivery and administration for vaccine.
Will people be pulled off the wait list again?
And what we're going to do with J&J, because it is a new vaccine, is we're looking at establishing a voluntary wait list so that people will are fully informed of what they're getting, just because of discussions around that.
Thank you. And this specifically asked for the mayor and Dr. Peirce to answer the question. Governor Abbott has indicated he's considering rolling back some COVID restrictions like mask mandates. Do you support rolling back COVID safety restrictions at this time, or are you concerned they could lead to a COVID rebound?
I said I was going to be nice this week, so Dr. Peirce, why don't you come?
Yeah, so let me be clear. I would say this is absolutely not the time to do that. It's too early. So if you consider how many people have been infected, which probably in the 15 to 20%, we're waiting on some prevalence studies, probably 15 to 20, we've got a tiny amount of vaccine, which means there is still a huge portion of the population which is still susceptible to becoming infected. And I just told you a couple minutes ago that we now know that there is a fair amount of UK variant in the community. So no, this would not be a good time to do that. I hope that the governor will consider differently. Even if you listen to the CDC and Dr. Fauci and others, there is considerable talk that we may be looking at another wave come in April. So if we want another wave, then you should do those things. But nobody wants another wave. So I would recommend that the governor not reconsider that position. And one other thing, just so people know, to Director Williams' point about, the sensitivities about the Johnson & Johnson vaccine, I may also be clear, in my opinion, the best vaccine you can get is the one that you can get. All right? The Johnson & Johnson vaccine is highly effective, but it's being compared to the Pfizer and Moderna, which are just way more effective than people had ever anticipated in the 90% range. That's just way higher than anyone had ever been expected. So now as we're looking at Johnson & Johnson, which is in this, the 75% range effectiveness, that is a very, very effective vaccine. So let's not get our standards messed up because Pfizer and Moderna just happen to be so powerful. The Johnson & Johnson vaccine is an excellent vaccine, and if you can get it, you should.
And any vaccine that'll keep you out the hospital and keep you alive is worth getting. So don't hesitate. And then let me just, and I wanted you to hear from Dr. Peirce before I answer that, because I don't want enough of the making it political. But this is not the time to take the mask down. Okay, quite frankly, it's just like I reported over 700 new cases of this virus today and 7 new deaths. These numbers are real. These numbers are real. And it's only to the point where we are saying no person has died, and you're into the single digits. But I remember in the last week in April of 2020 when we reduced the standards. And I remember in May, June, July, and August when the numbers went up. I remember in the late fall when the state reduced the standards. And then the numbers went up again. Okay? So this is not the time to be saying people don't have to wear masks, that we want to lower the standards. It's one thing to ease up on some of the standards in a methodical, deliberate fashion. I got that. But my main concern would be taking these masks off or saying you don't have to wear the mask. I think we can ease the standards in other areas. As I look to ease some of the standards later on this month in March when it comes to Little Leagues playing baseball, things of that nature, some of our parks and recreational facilities. But I do encourage people to keep these masks on, okay? So feel very strongly about that. There was a question in reference to the, I'm sorry.
I'm done.
Okay. And then with respect to the rental assistance program, in terms of new tenants applying, that number is 14,075. In terms of those being rolled over from previous wait lists, that number is 9,734. So roughly 24,000 people are being served in the rental assistance program, and then over 8,700 landlords have applied for the program. Okay. I think, yes, sir. And I do want at some point, Councilmember Robinson, to at least say some of this in Spanish, if you don't mind. Okay.
On the winter storm, do y'all have any better idea as far as how many people are still impacted by this? Don't have water, busted pipes. I don't know if the city has a better, as far as any kind of figures, or if not, where the greatest impact is right now. What areas of town, what neighborhoods are the ones that are being hardest hit right now?
It's kind of all over. I asked Director Haddock that same question this morning, whether or not we could look on our system and get up a specific number. We're still trying to do that. We know that the need is in the thousands across our city and across our region. It's just like on the mass distribution water, food site that we set up over 24 hours on Sunday. And more than 3,000 cars came through that one site yesterday. That points out the tremendous need, and that was on the north side. There are still a number of apartments that are without water, single-family homes, for example, with busted pipes. All I can tell you in a general sense, it's in the thousands right now. We're trying to quantify that number, and once we're able to quantify it, we certainly will make it available.
I guess would it be correct to say that as far as those residence areas that are still being impacted, are these some of the communities of color here, the communities the lower income communities that have disproportionately been impacted by disasters in the past?
I think that's fair to say that there certainly is a disproportionate impact in many of these communities of color. And that's what we've seen in all of these major events, so to speak. All over the city, though, there are pockets all across the city, whether you're talking about the north side, the south, east, or west, because we're getting calls from all throughout the city asking for help, asking for assistance. But I think what you will find in Marissa, even her reports on Resilient Houston, that's one of the reasons why we certainly wanted to put it out today, is that when you look at all of these events, there are certain communities that constantly are being disproportionately affected. People who don't have the means to go get a hotel room, people who are still looking for the means to hire a plumber, a licensed plumber, people that have high food insecurities because of all the other conditions that they are facing. And more so than not, these are communities of color. These are communities that are represented by a great deal of diversity, but they are all throughout the city of Houston.
And the last question, many of these communities like Cashmere Gardens, Fifth Ward, this is just the latest disaster that they've had to deal with. And some of the residents, advocates I've talked to, they've talked about, they feel that these, that in the past they haven't gotten the help that they've needed to fully bounce back. And you layer in another disaster, it just sets them back even more. How do you sort of reassure these individuals? And a lot of the individuals have said that, they've applied for FEMA or other aid, they didn't get that, or they have difficulty in getting that aid. How do you reassure these individuals that they are going to get the help that they need, and the cycle of disaster and sort of an incomplete recovery, and then they get another disaster? how do you sort of reassure them that they're going to get that help they need and they don't keep going through this cycle of disaster?
Mercy, you want to address that first, and then I'll come back?
So that's exactly the challenge, and we've been looking at particular communities after Hurricane Harvey. We've been looking at how to embed resilience in with the mayor's complete communities plans in order to really show that when we're implementing the resilience actions, they're benefiting the complete communities and other locations that are disproportionately affected. And so our priority is on trying to reach folks equitably first in the resilience actions that we're investing in.
And let me just say, a year ago, we set up the Health Equity Response Task Force. That is specifically geared to communities of color and communities that are already on the margins. Complete communities is something that we initiated 4 years ago. When I first came in, the focus is on communities that have been underserved and under-resourced. That's been the hallmark of this administration since I became mayor, and we have not strayed away from that. All of the distribution programs that we have put forth from the beginning of the coronavirus, well, even really going back to Harvey and before, has been focused on these communities that are underserved and under-resourced. Now, have we been able to address every need? No. Okay. Do we need to do a lot more? Absolutely. Is it important to build resilience in all of these communities so that every neighborhood is a neighborhood of promise? Yes. Have we said that to people in our city, that regardless of your ethnicity, your language, your faith, your social economic status, that we hear you, see you, and we want to respond? Yes. But our job is far from complete. Far from complete. And I want to acknowledge that. Just like a lot of these people who are stuck in these apartments without running water, they're there because they have limited means. Otherwise, if they had the means, they would pack up and go someplace else. Okay? So they are there because they don't have the means. They are there. And we're going to do everything we can to assist them. But I agree with you. There are a lot of people who are on the margins. And these storms only serve to push them down a little bit further. But we're going to do everything we can within our power to lift them up and to stabilize their situation and to put them in a much better place so that they can be more resilient the next time these shocks and stresses come their way. Councilman Robinson, if you would really, in Spanish, talk about the other vaccine that's coming, the J&J, and that is available, and to encourage people to get tested and get vaccinated.
Okay. Hola, bienvenido. Esta tarde estamos hablando sobre la tercera inyección, la vacuna de Johnson & Johnson, y que estamos añadiendo unos 6,000 de vacunas ahora, y que esas van a añadir a nuestros totales. En este sentido, tenemos ya el vacuna de Pfizer, también la otra de Moderna, pero en este caso la tercera es Johnson & Johnson. Es única en la manera que solo necesita una vacuna para su implementación, para usar con la gente, con la población, y en este sentido estamos añadiendo 6,000 de vacunas para añadir a los 6 que tenemos ya con FEMA, y que está establecida ya en Energy Park, y también las otras que tenemos 9,000 con la de Moderna. Ok, gracias, señor alcalde. Él habla bien, pero gracias por invitarme al podio. Y en este caso también los médicos, Dr. Pearce está diciendo que la tasa de infección está bajando poco a poco, nivelando ahora como en el 4.5% de la población, y está bien, es un avance bien, pero al mismo vez no es una noticia que puede seguirnos a bajar nuestras protecciones. Y en este sentido estamos aquí para decir que es importante que usas la vacuna que está disponible a ustedes. Y gracias, señor Peña, por estar aquí con tus fuerzas también. Sí, señor.
Han dicho van a venir 6,000 vacunas de Johnson & Johnson.
Sí, la nueva.
Esas son independientes a las que se están impartiendo por parte del gobierno federal de FEMA, ¿correcto?
Sí, exacto.
¿Cómo se va?
9,000 del Pfizer, que está en Energy, separada a lo que estamos añadiendo ahora con Johnson & Johnson.
¿Cómo se van a decidir en dónde se van a aplicar esas vacunas? Se decía que iban a llegar al centro de FEMA, pero dicen que son independientes a las de FEMA.
Sí, exacto. Pienso que es importante que no estamos separándolos, usando las listas que tenemos para avanzar estas inyecciones que posiblemente usamos con poblaciones diferentes, y hay que ver la que es lo más eficaz. ¿Sí?
Decía el alcalde que estas vacunas pudieran ser más efectivas, por ejemplo, en la población indigente, porque es solamente una dosis.
Exactamente, porque la segunda vez algunas veces es difícil para encontrar la misma gente y aplicar la segunda vacuna, y en este sentido es mejor, y los niveles de efectos son muy parecidas, una diferencia de 75% con la nueva, en vez de algo un poco más, como 95% con la segunda vez de los otros dos tipos de vacunas. Okay.
All right. Can we get past this? Sí se puede. I heard you say alcalde. That was me. Okay, I got that much. Okay. All right, thank you all so very, very much.